How do you think?
Hi, everyone. Welcome. We'll just get started here in just about a minute or two and let folks join. Happy Thursday. Happy last day of March. Welcome, everybody. We're going to get started here in just a minute or two. Thank you for joining today. All right, we're at the top of the hour, so I think we can go ahead and get started. I'm Maddie Gustafson, Project Coordinator at the National Environmental Health Association, and I'd like to welcome you to the Reducing Nitrogen Loading with Enhanced Septic Systems Social and Environmental Considerations webinar. Throughout our presentation today, I encourage you to drop questions in the Q&A box, and we will get to them following our presentation. I'm pleased to introduce to you our moderator for today's session, Bailey Stearns, Communications Specialist from the Environmental Protection Agency. Bailey?
Thanks, Maddie, and thank you to NEHA for having us today. Our speakers today are Dr. Tim Gleason, Dr. Laura Urban, and Alexi Redman. Tim is a supervisory research biologist in ORD, where he has over 30 years of experience in marine and coastal environmental research. Laura is a hydrogeologist with ORD, where she works to reduce human exposure to the adverse effects of groundwater contamination. And Alexi is an ORISE fellow in ORD, where she studies the human dimensions of coastal water quality. I'm going to pass it over to our first speaker, Tim, who's going to start us off today.
Hi, folks. Thank you so much for the warm welcome and for the opportunity to speak to all of you today. Much appreciated. So we're talking about our reducing nitrogen loading with enhanced septic systems. And this is part of a broader study looking at solutions-driven research to solve the broader nitrogen problem. But I want to point out a key element of this work is in the subheader, the connecting social and environmental sciences together is a key element for our solutions-driven research. If I could have the next slide, please, Alexi. So, why do we care about nitrogen? Why do we want to control it? These pictures could be from almost anywhere in the United States. I think most people have seen water bodies that have algae blooms and degraded water quality that is driven by nitrogen pollution getting into these embayments. In estuaries, the algae growth can block light that would be reaching seagrass beds, causing the seagrass to die off and eliminating an important habitat feature in coastal systems. And you may have heard in the news recently of starving manatees because of the loss of seagrass beds in Florida. So this is again, over-enrichment is a key part of this, and we're approaching it through a solutions-driven research project. If I could have the next slide, please, Alexi. And our goal is to work with our partners to solve their problems and inform a watershed-based approach or a series of watershed-based approaches to reduce nutrient loading. And a critical element of this are partnerships. One of the vexing parts of the non-point source nitrogen problem is that no single entity has authority over the entire problem, meaning that we have to work in partnership if we want to solve this problem. And then one other key principle for us in our solutions-driven research is the solutions have to be transferable, right? So we may be studying a specific system very closely, but those results need to be transferable elsewhere where the problem exists. If I could have the next slide, please, Alexi. So as mentioned, this is a nationwide problem. more than 1 in 5 households use on-site waste treatment systems or septic systems. The figure on the left, the chart map on the left, shows where those are most common. And it's important to know that a septic system can be working perfectly fine. It doesn't have to be failed in order to, but it will still contribute nitrogen pollution. Septic systems were designed for public health, to remove pathogens. They weren't designed originally to remove nitrogen. But the scope of the nitrogen problem in our coastal systems and ponds means that we do now need better low nitrogen septic systems. If I could have the next slide, please. So as I mentioned earlier, partnerships are key for this work. And for this project, the partners that are listed on the left are really critical to this septic system experiment. So the Barnstable Clean Water Coalition is a local nonprofit. They're our key partner for the entire solutions-driven research project. But for this study, they're critical. We couldn't do the study without them. They are funding the installation of novel septic systems at people's homes. And they're actually doing a lot of working through the permitting process, working through engagement of the homeowners and convincing people that it's a great idea to let us dig up their yards. George Hoyfelter here in the picture on the right is from the Massachusetts Alternative Septic System Test Center, and they're nationwide experts in innovative septic systems at MassTC. USGS is an important part of this project. They are leaders in groundwater and analysis of groundwater, and they're a key partner for us for this. The town of Barnstable has been a key to helping us get all these pieces going and get through various permitting steps. The Nature Conservancy has been funding efforts to evaluate innovative financing so that if this project is as successful as we think it will be, the need to scale this up beyond a neighborhood to regions and nationwide will require innovative finance. So they've been looking at that element. And lastly, the Mass Department of Environmental Protection, they have ultimate authority over regulating septic systems in the state of Massachusetts. And so we've designed this study, keeping them informed, and designed the study in a way that will provide the information they need in their permitting process. So with that as a backdrop, I'll turn it over to Laura.
Thanks, Tim. So I'm going to zoom into Cape Cod and specifically give a little bit more background to the context that we're facing here. On the Cape, septic systems are responsible for about 80% of the controllable local load. And what that means is that, as Tim said, even when a septic is working as designed, it's leaching, continuously leaching excess nutrients, including nitrogen and co-pollutants, into the groundwater. And here, groundwater is the only source of drinking water supply. This is a sole source aquifer. And that aquifer travels to ponds, streams, and estuaries, causing impairments that are driving a number of actions in these watersheds to reduce some of the impacts. Next slide, please. And one of those drivers and mechanisms is the determination of total maximum daily loads, or TMDLs. This is something EPA is responsible for. It's an accounting of the amount of loading that a watershed can sustain and still sustain its uses. So more than half of the watersheds across Cape Cod are impaired and have nitrogen TMDLs, which are driving these load reductions, or largely responsible for driving load reductions. And it's estimated through this process that Cape-wide, about 50% of the septic load would need to be mitigated in order to meet those water quality goals. Next slide. So we've been working in the Three Bays watershed, one of those many watersheds that are impaired on the Cape. It has thousands of septic systems, and it's part of most of the watershed falls in a town that has a comprehensive wastewater management plan to address that loading, that wastewater source, and reduce it towards the TMDLs. And that plan is sort of visually laid out here. It's slated to take 20 to 30 years to complete. And so in the meantime, communities are pursuing other solutions, alternative solutions that are complementary to sewering, that may be able to achieve nitrogen load reductions more quickly or in areas that sewering won't cover. Next slide, please. And so a traditional cesspool or septic system is associated with a range, but sort of a constrained range of nitrogen and effluent. Innovative and alternative septics that are designed for nitrogen removal in the state of Massachusetts are currently targeting a 19 milligram per liter performance target. Enhanced septics are capable of the latest and newest enhanced IA technologies are capable of getting down to a lower range of about 5 to 10 mg per liter at present. And that's starting to be comparable with performance of advanced wastewater treatment systems. And so relative to that 50% septic load target I showed before, the current IAs are not going to be sufficient to meet that. We really need enhanced septic technology beyond what's currently available and generally approved for use on Cape Cod to be a contender, to be a viable alternative solution. Next slide, please. And there are a number of concerns related to enhanced septics from regulatory and management point of views that have so far precluded their widespread use. And those concerns include higher costs, limited incentives to upgrade really, except for some kind of rare and niche circumstances that require homeowners to use them. There's still a niche technology. As I mentioned, the nitrogen performance target isn't sufficient in many subwatersheds. And there's still concerns about co-pollutants even after we've done a good job removing nitrogen. Next slide, please. From a homeowner point of view, there are similar concerns, and additionally, the lack of clear information and understanding of how IAs work or enhanced septics work, concerns about maintenance and monitoring over the long term, and concerns about aesthetics, noise, and smell. So all of this is by way of saying there's a kind of a lot of hurdles to overcome as we think about using these in impaired watersheds. Next slide, please. So Alexi and I have been focused kind of jointly on this question of how well do those latest enhanced septics work for people and the environment. And the goals and the sort of meaning behind enhanced, we're targeting that 5 to 10 milligrams per liter effluent, so a better performance standard, and systems that are affordable, simple to install and maintain. And these goals have been developed in close collaboration with all those partners that Tim mentioned earlier. These are sort of collective understandings of vision for what we want to see be available to homeowners. Next slide, please. And so breaking down what we mean by people in the environment, Alexi's going to talk more to the user experience. I am going to tell you about how we're studying groundwater in areas where we're deploying these. Next slide, please. So we first screened the 3-Bays watershed for a good place to work, looking for places with high wastewater loading, late phase of sewer plan, short groundwater travel times to surface receptors. We extracted sediment cores and groundwater samples and took water quality profiles in collaboration with our partners at USGS and the town and the Clean Water Coalition, as was discussed. Next slide, please. We ended up working at a site of really high housing density. These are 1/4 to 1/2 acre lots. It's near a kettle pond and recreational amenity. So local residents have a strong connection to water quality here. There was significant homeowner outreach by our partners to focus on this neighborhood for these deployments. Next slide, please. So we worked hard to site and cluster a group of enhanced septics in this area. So getting a cluster in close proximity on those small lots would allow us to be able to demonstrate not only their individual nitrogen removal performance, but cumulative impact on groundwater quality. So here, our partners have been leading the charge to perform retrofits and full replacements depending on the existing conditions at each home. We're using proprietary and non-proprietary carbon or wood chip based technology, so that carbon source is effectively enhancing denitrification at the appropriate stage in the wastewater effluent disposal process. So to date, we've completed 8 of those upgrades with more slated for 2022. Next slide, please. And we're monitoring those impacts using a before-after control impact design to the monitoring network. We've sampled for a year, a year of quarterly monitoring already, sort of pre-impact. It's too soon to see the changes that are resulting from having put those 8 septics in and the next round that'll come. We're sampling not only in the areas of that impact and upgrade, but also adjacent areas to serve as controls. So similar housing density, but where they're using traditional septic technologies. Nitrate is our primary outcome of interest. That's the most prevalent form of nitrogen in groundwater, and it's regulated in drinking water. And as I mentioned, the study's ongoing, and so it's too soon to see impacts, but we hope to demonstrate that change in the near future in groundwater quality. Our partners are also monitoring the individual systems themselves towards regulatory compliance and that general use approval that would make them more widely available. So that involves sampling influent and effluent at the upgrade portion of the treatment unit. So some of these systems involve just adding a denitrifying unit sort of in line with the septic tank that's there in the existing treatment area. Next slide, please. Others involve modifying that treatment area and including a lysimeter below it. So I'm going to pass the torch to Alexi, which is good timing.
Thanks, Laura, and thanks, Tim. So beyond some of the, is my screen moving for you? There we go. So beyond some of the technical and environmental aspects of IA systems that Laura just talked to you about, we also have to consider the people side of these systems. So I want to start you all off with a quote from an engineer who's been working with these systems for a number of years. She writes, "No matter how technologically promising a system might be, it cannot achieve either sanitation or sustainability goals unless people are willing to use it." And so this quote highlights the importance of understanding some of the social factors that might get people to adopt these systems. And it also talks about it also touches on the fact that social or cognitive factors could either be drivers or barriers to people adopting these systems. And I just want to clarify that when I use the word adopting a system, I basically mean installing a system. And so we set out to understand some of the social and cognitive barriers that determine IA system adoption. And we did this because if you look at the literature, there's not that much out there about some of the social and cognitive factors around nitrogen reducing technologies outside of the agricultural realm. But we also do this more importantly because there are a number of unknowns about these systems, as well as the process of installation from the perspective of homeowners, as well as people that are implementing these system installations. And so in order to kind of understand these unknowns and to address them, we need to speak and learn from the homeowners who are the end users of these systems. It's also important because the adoption of these systems is voluntary. So these are primarily installed right now on a piloting basis. They can also be installed due to local mandates, but those are kind of more the exception rather than the norm. So if these are to actually be used as a tool to mitigate nitrogen, then they need to be socially desirable. So we need to learn about those social factors. So our objectives were to speak with homeowners and learn from their experiences, to identify factors that drive or inhibit the adoption of these systems, and to also identify some of their uncertainties and lessons learned after having adopted. And by doing this, we hope to help decision makers either improve how these systems are communicated. We also hope to provide guidance on target issues to specifically target to reduce barriers to adoption. And we hope to better target homeowner outreach based on characteristics of homeowners who are most likely to adopt these systems. So to inform this research, we looked back at interviews that other scientists in our lab had conducted with decision makers around nitrogen reducing technologies. We also looked at the literature on decision-making and behavior change models. And these are an array of models that essentially explain how and why people make decisions. And there are a number of different factors that go into decision-making, both internal to an individual and also external. And we ended up settling on this model that I'll touch on in a couple slides by Reimer et al., where they essentially model farmers' decision-making around the adoption of agricultural best management practices. So we also learned a lot from the literature on the adoption of technologies that are similar to IA systems. So these are technologies like agricultural best management practices, household solar, and electric vehicles that have much longer research histories than IA septic systems, but they also require a high upfront initial cost to adopt. they're perceived to be environmentally friendly, and the unit of adoption is either the individual or the household. And so what this literature taught us was that there is much more to adoption than simply the market availability, the cost, or the efficiency of a technology. So we conducted a series of homeowner focus groups in summer and fall of 2020. These were virtual, and we spoke with people who had installed these systems. We also spoke with homeowners who were in the very early stages of adopting these systems from Massachusetts pilots. We did try to speak with homeowners who had not adopted these systems, but it was tough to recruit from that group. So we had only spoken to a couple of them. We relied pretty heavily on our partners to recruit for these focus groups because, as Laura had mentioned, this is still kind of a niche technology and a niche group. And so our partners gave us lists of homeowners that participated in their pilots. And then either we contacted them or our professional focus group contractors contacted them. We sent our participants a focus group guide a couple days before the focus groups so that they could familiarize themselves with the process and also with the software that we were going to use. And then we actually went and implemented the focus groups. So we conducted 5 focus groups. We spoke to 28 homeowners from 25 households. And these focus groups lasted roughly an hour and a half on average. And so they consisted of a card sorting activity called a Q-sort, a brief one-on-one interview, and then a larger semi-structured group discussion. Due to technical difficulties with implementing this research, essentially at the beginning of the pandemic, and difficulties with people using Zoom, and also software difficulties, we were not able to actually analyze the card sorting activity, but it is important to mention because it could have influenced some of the discussion that followed. So we recorded the focus groups, we transcribed them, reviewed our transcriptions, and then we coded them for different themes in a software called NVivo, which is pictured on the right hand of your screen. We also did an intercoder reliability to make sure that we were moving as much subjectivity as possible. And then once we had all of our themes coded, we created a model to illustrate what goes into homeowners' decision-making around these systems. So I'm going to show you first a skeleton of this model. This is the model that we modified from Reimer et al. It's simplified in that it's linear, and we know that decision-making is not linear, but this is something that is easy to use and understand. So we begin with our catalysts. These are the drivers that initially get homeowners to consider installing these systems in the first place. Then we have our background factors. So these are factors that exist kind of outside of the adoption process that still influence adoption. So these could be like policies or the availability of funding. Then we have our perceived practice characteristics. And this is how homeowners perceive these systems as well as the process of installation. And then we have our resulting attitudes, beliefs, norms, and intentions around adoption and these systems. And finally, all the way on the right, we have the adoption of an IA system. So I'm going to walk through these and just give you an example of each one so you can get an idea of how it works. So first, we have our catalysts. We identified 3 main catalysts that really drove homeowners to consider adopting these systems in the first place. And these included whether they perceived the need to replace the system because it was old or failing, or to comply with regulatory requirements, and also a desire to protect the environment. And we found that it was really a synergy between these kind of 3 factors that drove people to want to install them. One quote that touches on several of these catalysts reads, "My system was failing. If I was going to replace it, I was going to upgrade and accomplish the goal of improving the water quality. There was no question in my mind that I wanted to do something that would contribute." So then we have our background factors, and there were 4 that really stood out to us. These included whether an IA system met technical and regulatory requirements, whether homeowners had access to sufficient funding, whether they had the right property for one of these systems, and whether they possessed environmental values. And so one homeowner touched on a couple of these factors, and he mentioned, "I've seen the degradation of the cove and harbor markedly over that period of time. It's effectively dead. I did it out of a moral concern that I enjoy the water that I live and play on and felt I had the resources economically and that it was the right thing to do." So then we have our perceived practice characteristics, and there were 3 major themes here. One was whether homeowners felt they had access to trustworthy and easily understandable information on these systems. The other was whether they felt these systems were affordable. And it also whether they had anticipated concerns related to the appearance, noise, or smell from these systems. And so pretty overwhelmingly, most homeowners agreed that the information that's out there is just not accessible. One homeowner mentioned, "No one could give me an idea of what it was going to cost to run the system month to month." Additionally, many of them spoke about the kind of cost burden that these systems pose to them. And so in doing so, they talked a lot about the cost disparity between traditional septic systems and IA systems. They talked about the need for a subsidy to kind of take that cost burden off. And then they also talked about installation and long-term costs associated with these systems. So one homeowner shared, "I don't make that much money, so adding another $1,200 a year just to maintain my system, which already costs a fortune, is a lot." Finally, when it came to anticipated appearance, noise, and smell, this was actually not as much of an issue as we had anticipated. There were several homeowners who had some concerns, but it really wasn't reflected by the majority. So then we have our resulting beliefs, attitudes, norms, and intentions around adoption. And despite this lack of accessible information, most homeowners were very confident in the IA system technology. And this confidence came from trusting the nonprofit organizations that were managing and implementing these pilots. One homeowner that was or is participating in one of these pilots told us, "I have no reason to believe that the pilot organization would tell us something that wasn't true. And the system they have seems very simple." Homeowners also had to be willing to spend their own money, and they had to be reassured that their landscaping and aesthetic concerns could be mitigated. And in many cases, those concerns could be very easily mitigated. So this is where we modify the Reimer model a little bit. We introduced some uncertainty here because we found that uncertainty was really pervasive throughout every aspect of IA system adoption. We even spoke to homeowners who, after having installed these systems, still didn't really understand their responsibilities in terms of maintenance and monitoring, or even their costs. So one quote that we feel really represented a lot of the homeowners we spoke to reads, "I think there is confusion on the different systems that are out there. I think for the layman walking into it, trying to navigate the different systems is a lot for 90% of the consumer homeowners to take on." So this is what a completed picture of decision-making around IA system adoption looks like. And again, it is simplified because it's linear, but this is something that people who don't have a background in social science or cognitive sciences can apply and understand. So this is what we've currently submitted to a journal, so it hasn't been published yet, but if you're interested, I can email you a copy of our draft manuscript. What we're doing is we're now using this information to learn how to potentially diffuse these systems to the wider population if they are to be pursued as a tool to improve water quality. And so when I say diffuse, I basically mean get more people in the population to adopt these systems, so wider spread adoption. So to do that, we're looking at the literature on behavior change strategies. We're also looking back at case studies on the adoption and diffusion of similar technologies like solar and electric vehicles. And so just a couple of the behavior change strategies that we're considering include harnessing peer effects, informational campaigns, establishing feedback mechanisms, framing and messaging, financial incentives, and making behavior change convenient. So I'm going to just give you examples of a couple of these as this is still ongoing. So the first I'll talk to you about is harnessing peer effects. And peer effects are essentially the influence that our peers have over our attitudes and ultimately our behavior. And these can be a very powerful behavior change tool. So in order to harness a peer effect, you need to model a desired pro-environmental behavior to set a new standard of behavior. You might think that this could be a little bit difficult considering that IA systems are located underground, but there are ways to make them more visible to the population. So one thing that our partner, the Barnstable Clean Water Coalition, did was record testimony from people participating in their pilots. And then they shared it on their social media and their newsletters, and even in local newspapers. And this testimony proved to be effective in garnering a lot of interest in this pilot. So on the right, you see a screenshot from one of the homeowners participating in the study. She's what you would consider a community champion. She's very well connected, well respected, and well known in the community. And she was really one of the first homeowners that they began working with. And so having partnered with her, they were able to garner enough interest to have at least 14 homeowners participating in this pilot now. So that just goes to prove that peer effects can be a really effective tool. So next we have informational campaigns. And for those of you that are familiar with the literature on information deficit, we know that simply providing people information doesn't translate to an actual change in behavior. However, In the case of IA systems, there are so many unknowns and so many sources of uncertainty that any effort to diffuse these more widely absolutely has to include an informational campaign. And so on the right, you see a table of different types of informational needs that we identified in the focus group. And then the bullets are just specific needs within those categories. One way that our partner actually addressed some of these needs was by creating a homeowner informational binder. And so this was a binder that included everything homeowners would need to know about the systems themselves, who to contact if they needed help, and everything about the process of adoption, as well as a Q&A. And this was all done in non-technical terms. So this could be really helpful for folks who don't really understand these systems and who have a lot of questions. The last behavior change strategy that I will talk to you about today is making behavior change convenient. And this is important because beyond just the financial costs associated with installing a new technology, there's also a burden in terms of people's time and effort spent researching technology. So some of the examples of the cognitive burden associated with installing an IA septic system includes permit applications, getting system approvals, finding contractors and engineers, applying for the subsidy, etc. And so one way we can reduce some of these barriers is by establishing responsible management entities, also known as RMEs. And these are essentially institutions that manage every aspect of the adoption of an IA septic system, from the paperwork in the beginning, throughout the installation, and then the maintenance and monitoring. And that takes a huge load off of the homeowners. So through the focus groups and by speaking to homeowners, we were able to identify a series of conditions, factors, and considerations that either drive or inhibit adoption based on whether they're addressed. We were also able to identify sources of uncertainty, and we noted that there was a pretty serious lack of accessible information on these systems. And what's important to note is that these concerns and these factors don't disappear if adoption no longer becomes voluntary. So even if these systems are required, someone is still making decisions around these systems, and these concerns still exist. So I just wanted to reiterate that this specific example on IA systems, it's just really one example of the interdisciplinary work going into the larger project, looking at these alternative technologies. And so the larger project strives to evaluate the economic, technical, and social aspects of a variety of alternative interventions that policymakers and decision makers are interested in potentially pursuing, along with some of the more traditional interventions like sewering or wastewater treatment plants. And so this project is still ongoing. It's been ongoing for 3 years, and it has been extremely partner-centric. So from the very identification of needs to the implementation of the research, data collection, and then translation of results, we've been working very closely with our partners to make sure that their needs are being considered and taken into account. And even though this is a very regionally specific project, it's transferable both in its partner-centric, solutions-driven approach, but it's also transferable in terms of its findings for other regions that are dealing with this persistent and challenging nutrient problem. So that's it as far as our presentation. If you have any questions, please feel free to let us know, and feel free to email us as well. Thank you so much.
Thank you so much, Alexi, and to our other presenters as well. We do have a couple questions in the chat, and as we address some of these other folks, please feel free to drop them in the Q&A or the chat. First question, or maybe a statement rather, wondering if tax incentive on building green. They currently have a huge building project of over 1,100 homes and a park. Any thoughts or remarks related to that?
Yeah, I think, it's kind of an all of the above sort of suite of incentives. So tax incentives might work for some people. For some people who don't have a lot of income, they might need a different form. They might need, a cash infusion to support it. So quick thought on that. I don't know if the others have something.
We do have another question about what is the estimated cost of the enhanced system and what maintenance is necessary?
So part of what we're doing in the study is really trying to capture all of the costs associated with the installation for a couple of reasons. One, so that we have that information going forward, but also so that we can look at the cost per kilogram nitrogen removed as a way to compare with wastewater treatment plants to see where in the environment these two systems make a difference. I think we're seeing, so Laura mentioned that in some cases it's a retrofit where we just add one unit and the existing septic tank and the existing leaching field are still used. And I think those are running in the $20,000 range for installation. And I realize that construction costs may vary considerably across the country, and they're probably fairly expensive, relatively speaking, out on Cape Cod. In general, I think these systems are probably running $10,000 to $12,000 more than a standard conventional septic system.
Great, thank you. Another question we have is, what journal will this be published in?
So the social component will hopefully be published in the Journal of American Water Resources Association. And if you're interested, I can send you the draft, so feel free to send me an email. I'll put it in the chat.
Yeah, I know you had a slide up with your contact information, so if you can drop that in the chat, that would be great as well. Next question we have is, what level of nitrates are found in the groundwater of this community?
Yeah, it depends on where you look. We have about 79 unique points underground where we're monitoring, and depending on whether you're looking at an area that is not strongly wastewater influenced versus you're right in the middle of a septic plume, we can get from almost nothing up to over 40 mg per liter nitrate as nitrogen. In general, it's sort of taking an average across the sites that we're monitoring, which we've chosen those sites to be indicative of wastewater influenced groundwater. We're seeing about 5 mg per liter nitrate as nitrogen.
I did see a couple questions too related to the NEHA CEs. I did drop in the answer section how you can do that, and I will drop that in the chat as well, how you can submit continuing education for this too. Next question we have one more here, so folks, please feel free to add more in. Oh, actually, no, we do have a couple more than that. Any differences in the nitrate concentrations in groundwater during dry versus wet season from year one?
There aren't strong seasonal differences that we've noticed. We also get questions about how use and sort of occupancy of these homes varies and how that might be affecting things. And maybe there's even a signal of people being home more during COVID. And what I can tell you is that there's a whole lot of spatial and temporal variability in the data that we have. But when you sort of collapse it down and look for trends, there isn't really a strong seasonal pattern in them.
Another question is, any incentive mechanisms that you already implement to entice people to support your technology?
Well, for the experiment, our partner, Barnstable Clean Water Coalition, is paying for the installations and for the subsequent landscaping. So there's no out-of-pocket cost to the homeowners to participate in the study. Realize that's not a viable solution nationwide, but in terms of trying to get a bunch of houses clustered together to do a study, that's how we've approached it.
So I'll just add to that. For some of the homeowners that participated in other pilot studies that we spoke to in the focus groups, they received incentives from $7,500 to maybe $10,000 towards one of these systems. I know there's another pilot in Rhode Island that has covered, I want to say 18 grand. So for the pilots, homeowners are receiving financial incentives, and the amount, it really depends on the amount based on the pilot.
Great. Last question I have here, if others have more. Did you drill the monitoring wells, or are you using private wells?
We drilled them. So this community is on public water supply. They're not using private wells here. There are other parts of Cape Cod where folks are using their own wells. And so we drilled all our wells in public right of ways, along the roads or in public lands in cooperation with the town.
Next question I have here is, are you using third-party testing like NSF 245 or BNQ equivalent for systems to be used?
So for the septic system monitoring, we're using the county of Barnstable. So the Mass Alternative Septic System Test Center will be taking the samples on either end, and the county laboratory will be doing the analyses. And for the groundwater, that will be USGS is conducting those analyses.
I don't see any additional questions. Any last comments or remarks from the group, seeing if anybody else has any more questions? All right, well, thank you so much to all of our speakers and to EPA. Oh, looks like we maybe have one more last question coming in. Is ongoing O&M cost the responsibility of the homeowner?
So for the study right now, we are covering the maintenance and monitoring for the first 3 years. And then I believe the Barnstable Clean Water Coalition will pick it up for the next 2. So the first 5 years will be covered. And at that point, the monitoring cost should be pretty low. We also anticipate that because these systems are relatively simple, that the maintenance on these systems going forward won't be that significant. But we'll certainly know more at the end of 5 years.
Great, thank you so much. I don't see any more questions in the chat, so we can let you all go. Thank you so much again for speaking, and Bailey and EPA as well. Really looking forward to continuing our partnership with you all, and hope you all have a great rest of your day.
Thank you.
Thank you, everyone.
Thanks for the opportunity.
Thanks for
Thanks,
having
everyone.
us.
Yes, of course. Have a
Thanks,
good day,
everyone.
everybody.
Bye.
Bye.
Okay.